Hey YouTube, it's James. Just want to say a massive thank you for all the people that watched my my first video. Really happy with the way it went. Just keep subscribing. Everything along those lines are doing very well. My second video, what we're going to talk about and introduce to you is what happens on a daily basis, medicine-wise, for a CF patient, and our daily routines that happen behind closed doors that not a lot of people know about. Okay, so you've briefly just seen an overlay of all my medicines, so I'm just going to talk just a few of them for you. So the main one at the minute for me is this Parry nebulizer, mouthpiece obviously, but I'm having 3 lots of nebulizers at the minute, ceftazidime, DNAs, and then we've got this hypertonic saline, which, if I'm honest, it's not nice. It's really salty and gets in the back of your throat, but what that job is to try and loosen up all the mucus for the antibiotic nebulizer to kind of hit in and take control. Before that, we'll go into it's called an acapella, where you're going to take about 10 minutes on this before you go into the nebulizers. This again is physio, just like going for a run around the yard or anything like that. It's good. It's exercise without actually moving, and it gets your lungs working a lot quicker. A little bit of a downside to some of the medication, prednisolone steroids. A lot of people are on them that I know of, especially within cystic fibrosis. These medications are designed for the inflammation of the lungs to kind of bring the swelling down, because common occurrence within CF is swelling of the lung, not just the infection within inside the lung, it's the outer lung as well. So the swelling, so that's there designed to bring that down. Side effects is makes you really hungry, can balloon you up a little bit. So if you, occasionally, if I'm on a high dose, I go quite puffy, big cheeks, but it's temporary. I'm on those usually, well, I'm on them permanently on 10 milligrams, but when I can get up to 30-40 milligrams when I'm in hospital, and I just have to think that is temporary. Okay, so moving on, insulin, CF type diabetic, so I'm on Tresiba in the morning, which is about 20 units, and then I go on to my Apidra, which all diabetics will know of, and I'm on maximum 20 with a meal, depending on what I eat and when I eat. Onto my digestion, Creon. Okay, I'm on Creon 10,000, and there is a Creon 25,000, which I've tried, didn't work for me, but it could work for others. It all depends on what you eat, when you eat, and your digestion system. Okay, the 10,000 worked for me better, because I found that I could use more precise doses to what I was eating more accurately. So I'm sticking to that, and whatever works for you, you stick to. Got all my vitamins, A, D, E and K. Pretty simple. I would have thought that most people are on those, so they just treat themselves basically. Slow sodium. Common, what's the word? Common part of CF is when we sweat as a patient, we sweat a lot of salt. So all CF patients I would know of are on slow sodium tablets. It's just a way of getting salt back into our bodies without losing too much salt. We get a lot of achy joints, get dehydration, things like that. Okay, so just to round it up then, this is what my morning tablets look like. You're looking at about, for me personally, every patient is different, But in the morning in here, there is 27 tablets. Afternoon, 2 tablets, which are my iron tablet, ferrous sulfate, and my ascorbic acid, which is a kind of a vitamin C way to get into your body and to enhance the ferrous sulfate. Evening, just before bed, taking another 11 tablets. So quite a lot throughout the day. So you can see that there quite clearly. I would say, so on experience, for me, it's taken me about 45 minutes in total before my day actually starts. So I'm getting up, showering, breakfast, everything like any normal person does before work. But then on top of that, I've got all of this to do, and it takes me about 45 minutes to get through the whole lot, because my 3 nebulizers can't all be taken together. I've got to do one, then about 5-minute, 10-minute break, then another 5-10-minute break, then the last one. Before that, I've got to do my physio, which was the acapella, also my inhalers. Okay, so yeah, it's a long procedure. It's hard work, but it's life. Okay, we just got to get on with it. I get on with it, and I'm one of millions basically. So just a little bit of awareness of what our daily life routines hold. Everybody's different. Everyone's going to have their own routines. I have an order that I do mine, and it's working for me. Occasionally I have to get a little niggle from my mum just to remind me where I'm at, what I've done. Have I remembered this? Have I remembered that? Especially when I'm taking tablets that are once a month tablets, because it's quite easy to forget those. But if I can give any advice to any CF patients, young or old, fitness, make sure you take tablets. Listen to your consultants, they know best. So thank you very much. Again, thank you for listening. Please subscribe, keep sharing the awareness for cystic fibrosis, and I want to wish you all a Merry Christmas, because tonight it's Christmas Eve. So I hope everyone has a Merry Christmas, and I'll look forward to my new post in the new year.